Okay.
Before I go and drop a boatload of moolah on eggs, should I be worried about low implantation rates with said endo?
Yeah, of course. And why do you need to have donor eggs? I mean, before you do that, find out what your AMH is like, how accessible your ovaries are. Can they get them abdominally? Can they get them vaginally? How many eggs will you make? I mean, just because you have endo doesn't mean you can't use your own eggs. Is it harder? Yes. Is the egg quality lower? Yes. Are you going to make embryos that have a higher rate of genetic aneuploidy? Maybe. However, it doesn't preclude you from trying. And we have hundreds and probably soon thousands of patients that have had endo that we are successful with. So I don't ever tell an endo patient to go straight to donor egg unless they have an abysmal AMH or their ovaries are inaccessible, right? Like I have one or two patients where I couldn't even access their ovary even after surgery and they had terrible AMH. Okay, those patients probably need a donor. But aside from that, I wouldn't tell anyone that. No,
What do you think of pre-seed lube for TTC?
it's great. Pre-seed lube is expensive as hell, but it's decent lube and it's very good for your fertility. It's the best of what's available.
Any post-retrieval recovery recommendations?
Lots of protein, lots of Gatorade. Take it easy. Don't try and go right back to normal immediately. It's uncomfortable. You'll be bloated. Try not to get constipated, so avoid things that constipate you. Take some laxatives and don't be shy to take pain meds. Sometimes you need them, and we're very liberal about letting our patients have the pain meds.
Should a 43-year-old who's regular and ovulating do an HRT or modified natural protocol for FET?
T, you want to answer that one? Modified natural or HRT, or do you want me to answer that one?
I think I want to go with I think first you got to start off with a good consultation to understand what's going on.
Okay.
I would say that's not the right first question. That would be, I'm like, you know what? We got to take a step back
And get the answers.
and figure out what's going on, and
Sure.
then decide on protocol. I think jumping to this or that is a bit premature.
So studies show that the sequence of success and lowest miscarriage is highest success, lowest miscarriage is letrozole, then natural cycle or modified natural cycle, and then HRT. So HRT has the lowest rate of success and the highest rate of miscarriage. So my answer is after the consult, which T is right about, you would absolutely not do an HRT protocol. We don't use HRT protocol for anybody unless they're in menopause. That's the only time it makes any sense.
That's where the consult's so important.
That's where the consult's
Absolutely.
important. There you go.
Hello.
Yeah.
Not to me, not to you, just a generic.
Just hello. Okay. Yeah. Neutral. They're Switzerland.
Yeah. What supplements do you recommend pre-egg retrieval, especially for egg quality and dosages? Thank you.
Prenatal vitamin. I mean, there's no dosage for that. There's a million different things in it. Melatonin, 3 milligrams a day. Vitamin D, at least 2,000, up to 4 or 5,000 a day. Coenzyme Q10, 600 milligrams a day. If you want to really get bold, ALA is probably very beneficial as well, 600 to 800 milligrams a day.
Do testosterone and DHEA help the follicles grow in a batch?
Yes.
If you had follicles grown at different rates in the past.
Yes, it can. Yeah.
Why do you use testosterone with high? That's it.
You held that note for a while, man.
I thought there was like another.
Do you like sing in the shower too?
No, never. Never. I'm anti even speaking in the shower. Someone's looking around for me, not a word. I'm non-existent.
Oh, really?
I'm anti-speaking in the washroom.
Really?
In any capacity.
Oh.
I go in there, it's silence.
The cone of silence?
Code of silence.
All right.
And then someone knocks on the door. I'm like, yeah.
Well, you have 5 kids.
Yeah, there's a lot of knocking.
lot.
There's a lot of knocking.
Yeah.
Right. Should you come off supplements or two before doing the fertility?
Supplements? No.
What is the optimal lining thickness for an FET?
8 millimeters or more. Less than 12.
Can priming with Omnitrope and Androgel cause high estrogen?
Yes.
Is there any proof sex a night before the embryo transfer helps implantation?
Yes, there's another study I'll probably share with you guys next week. Although we've done it before, but it's worth doing again. Nookie the night before is a good idea. So there is an improvement in live birth rates if you have sex the night before. There are studies that have shown that the ejaculate primes the endometrium to facilitate implantation. So we tell our patients to just keep having sex. Yeah. There's a whole bunch of
Great medical
TikTokers.
advice.
Yeah.